I'm J. Elias O'Neal, the Public Information Officer for Chesterfield County Government. I'm joined by Dr. Alexander Samuel. He is the Health Director for the Chesterfield Health District here in Chesterfield County. Dr. Alexander Samuel, welcome.
Thank you, Jay. Glad to be here.
Absolutely, absolutely. So let's go ahead and get into all the things. We know you're here to talk about COVID-19. Give us an update here in Chesterfield County. Lots of changes, obviously, since we last spoke. Boosters, second shots for boosters.
That's right. Yep.
And also some changes to the data input on the VDH website. So let's start with the second booster shots.
Sure.
Talk about, obviously, the importance of these, who qualifies for them, and if you are out there listening, if you might be entitled to one.
Yeah, right. Yeah. So there's been a lot of updates based on more research that's available on the effectiveness of vaccines and the need to get a booster as your immunity decreases over time. We're finding that's the case. So right now there are a couple of new variants that are circulating. The main one that we're keeping our eye on is a subvariant of the Omicron virus that came through over the holidays and resulted in a lot of infections. So the official name of this variant is the Omicron BA.2 variant. And health officials are looking ahead to the potential for that to create an additional rise. So there is a recommendation for individuals who fit into certain groups to get a second booster shot. And I know this can be confusing. There's boosters, there's second boosters, there's this term fully vaccinated. But basically, an individual who has received their first and second dose of a vaccine is considered fully vaccinated. Then there's the additional booster that's been recommended for most age groups. So everyone over the age of 12 is recommended to get a booster, the first booster. Okay. And then there are, based on additional evidence that's come out, a few groups who've been recommended to get a second booster dose. And so this includes individuals who are over the age of 50. So anyone over the age of 50, the CDC is recommending a booster for. It also includes individuals who are 12 years old and older who are either moderately or severely immunocompromised. That means their immune system simply can't maintain its level of strength or potency. A number of different conditions can cause that, like cancer or cancer chemotherapy. And the final group are individuals who are 18 to 64 who received the J&J vaccine as their first dose, their second dose, and or they got another vaccine for their second dose. So having J&J as your first dose now qualifies you to get a second booster vaccine, and that's typically either the Moderna or the Pfizer vaccine for individuals who receive J&J. So that's a lot of new information out there to kind of keep straight.
Absolutely. Mm-hmm. Now, has the location where people can get a second booster changed? Or can they still go to their doctor? Can they go to the pharmacy? Give us an idea of where people can get these second boosters if they qualify.
Yes, absolutely. Good question, Jay. Yes. Right now, it's pharmacies, doctors' offices, urgent cares. Typically a good idea to call ahead first to see if they're carrying it, but most places are. What's different now compared to earlier in the vaccine rollout is there are no longer those large-scale vaccination centers available as they were. And that's simply because demand for vaccine has decreased to the point where the other venues that I just mentioned are those that are carrying the weight of the vaccine need.
Absolutely. So let's shift gears a little bit. We've talked about second boosters, who qualifies for those second boosters, things of that nature. Now let's talk about kind of how the reporting has changed on the VDH website in regards to localities and COVID-19.
Sure.
There have been some changes, obviously. Can you give us an idea of what some of those changes are and what prompted those changes to begin with and when?
Yeah, well, I know a lot of folks were tracking data that was available on the VDH website, and this was data that that was basically looking at case numbers, community transmission metrics, vaccination status, et cetera, at the locality level. All of that changed on March 15th when the decision at the state level was made to no longer provide transmission-related metrics at the locality level or case number data at the locality level. My understanding is most of this is simply to have consistency with what's being offered at a national level. So that information can be found through the CDC website, which is offering weekly updates of locality-specific data. So you can search by state as well as by county to find that information now on the CDC website.
Great. Now, how does this switch over to the CDC website?
Yeah.
Like, how does that inform localities of kind of what's happening
Yeah.
with COVID-19, and how does that help families
Sure.
also determine how best to protect themselves from this virus?
Right. Really good question, Jay. I mean, the idea is basically, again, to have consistent recommendations based on levels of virus in a given community. So the CDC has pretty much standardized their approach, and they're looking at what you should do if your virus fits their categorization of low, medium, or high community transmission. And they have numbers associated with that, like case count averages per day or week. And so if a community is in a low transmission level, pretty much no need for masks unless you have an underlying health condition or really concerned about risk based on where you work, for example, your proximity to the public and so forth. And then for each of those other levels, medium and high, they pretty much ramp up the thoughts about additional barriers or layers of protection, wearing a mask, social distancing, increased ventilation in buildings, and so forth, again, based on community level of virus.
Excellent, excellent, excellent. Well, again, very informative discussion, Dr. Samuel. And again, Chesterfield County, if you are looking for additional information on COVID-19, because we are still around with it, go to our website. That's www.chesterfield.gov/COVID-19. As always, thank you for your time and stay safe, Chesterfield County.